pain management. We are from Hot Group 2, and my name is Putri Novianty. My name is Putri. My name is Mevia Azzahra. My name is Nathania Amanda. And my name is Kumala.
So this is the outline of our presentations today. The first is non-pharmacological pain management, pharmacologic pain management, pharmacoregional pain management technique, systemic drugs for labor, and special considerations, and vaginal birth anesthesia. The first that we are going to present is the non-pharmacological pain management. The advantage of non-pharmacological than the pharmacological is they do not slow the labor and have no side effects than the pharmacological. And the only realistic options for a woman who entered a hospital in advance with rapid labor. So when a woman have rapid labor, sometimes pharmacological is not an option, so they need non-pharmacological options to reduce or relieve the pain. And some pharmacological methods may not eliminate labor pain, and a woman needs non-pharmacological methods to relieve the remains pain. So the limitations of non-pharmacological method is first, they not always achieve their desired level of pain control because non-pharmacological method is not means to be the only source of pain control because non-pharmacological usually combine with the pharmacological method. Next. Yeah, so this is the applications of non-pharmacological methods or technique that can be applied in women in labor, such as relaxations, vaginal stimulations, hydrotherapy, mental stimulations, and breathing technique. Next. Yeah, so the first one is the relaxations. While in this technique, there are several components such as environmental comfort, general comfort, reducing anxiety and fear, specific relaxation technique. The first one is environmental comfort. We as a nurse usually modify or make the environment surrounding the woman as comfortable as possible. And the general comfort usually is promoting the woman's personal comfort to help her focus on using pain management technique during labor such as this. The general measures is make a cool cloth apply to the face to make the woman comfortable, and reducing anxiety and fear. This means that the nurse helps reduce the woman's anxiety and increase her self-control by providing accurate information and focusing on normality of her labor. And the last is the specific relaxation technique. Is a technique which the woman contracts and then release specific muscles group until all muscles are relaxed. The woman can learn touch relaxations in response to her partner's touch, and relaxations against pain as the partner deliberately causes mild pain and the woman learns to relax despite the pain. And the second one is the cutaneous stimulations. You can make some stimulations in the cutaneous membrane by self-message by others such as nurse, family, friends, or other closest people, and counter pressures, touch, thermal stimulations, and acupressures. In the pictures, the nurse or the coach applies sacral pressures or the counter pressures in the back of the woman. It's common to focus to less the pain during labor.
So for the third pharmacology therapy is called as hydrotherapy. So hydrotherapy involves the giving birth mother to immerse herself in warm water for relaxation. So because the giving birth mother has a contraction, it will help the mother to make the pain is less, and the warm water can relax the muscle of her body. But however, this method only suggests for the woman with not more than 5 centimeter dilatation to prevent labor contraction, and also for the woman with rupture membrane, it will de- it will it will it will increase the risk of infection if the mother has the hydrotherapy method. And the next one is mental stimulation. This method focuses on attention and imaginary with using various senses. And the stimuli that we give to the mother is such as tactile stimuli, audio stimuli, and visual stimuli. And the next one is ambulation. Ambulation means that a position changes, such as walking, kneeling, and others. So it will make the mother feel better, and active movement can active movement can make the mother is distracted but and doesn't think about the contraction that she had. And also the next method is breathing technique. This technique is a very common technique. So the nurse usually suggests the mother to have there are 4 types of breathing, such as slow paced breathing and pattern paced breathing and modified paced breathing. And the next one is combining techniques. So this technique will help the mother to relieve her abdominal pain because it will relax the muscle in the abdominal. And this technique can be applied to the mother if the mother cannot walk or moving around. So if the ambulation technique cannot be applied to the mother, so the mother should use this breathing technique.
Now for the pharmacologic pain management, there are several special considerations for medicating a pregnant woman. The first is the reason or any drug taken by the woman is likely to affect her fetus, and then the drug may have effects in pregnancy that they do not have in the non-pregnant person, and the drug can affect the course and length of labor, and pregnancy complication may limit the choice of pharmacologic pain management method, and last is women who require other therapeutic drugs, use herbal or botanical preparations or practice substance abuse may have fewer safe choices or for labor pain relief. And these are the effects of the drugs on the fetus. There are 2 effects, direct and indirect effect. The direct effects is effect on the fetus of drugs given to the mother may be direct, resulting from passage of the drugs or its metabolites across the placenta to the fetus. An example of direct effect on the fetus is decreased FHR variability after administration of an analgesic to the woman. And for the indirect effect, for example, if a drug causes maternal hypotension, blood flow to the placenta is reduced, and fetal hypoxia and acidosis may result. And for the maternal physiologic alteration, normal pregnancy changes the woman's body and have the greatest implication for pharmacologic pain management method. And the first is the cardiovascular changes, as the compression of the aorta inferior vena cava by the uterus can occur when a woman lies on the supine position. And according to White, Duncan, and Baum, blood pressure is the highest during contractions, so blood pressure should be taken between contractions. And for the respiratory changes, a woman's full uterus reduces her respiratory capacity, and to compensate, she breathes more rapidly and deeply, and as a result, she is more vulnerable to reduced arterial oxygenation during indication of general anesthesia. And the normal edema of pregnancy is also present in her upper airways and may present difficulty if she must be intubated for general anesthesia. For the gastrointestinal changes, a pregnant woman's stomach is displaced upward by her large uterus and has a higher internal pressure. And the progesterone slows peristalsis and reduces the tone of the sphincter at the junction of the stomach and esophagus. And these changes can make a pregnant woman a lot more vulnerable to regurgitation and aspiration of gastric contents during general anesthesia. And the nervous system changes. During pregnancy and labor, circulating levels of endorphins and enkephalins, natural substances with analgesic properties, are high. And these substances modify pain perceptions and reduce requirement for analgesia and anesthesia. These are the effects of medication. The first is effects on the course of labor. And ideally, analgesics are given when labor is well established to avoid slow progressing. However, caregiver must consider the adverse effects of excessive pain on labor progress regarding of the cervical dilation. And for the regional analgesia, primarily the epidural block can slow progress during the second stage by reducing the woman's spontaneous urge to push. And this can cause the contraction to even more slower. And effects on complications. Complications may happen during pregnancy and limit the choices of analgesia or anesthesia. For example, large volumes of IV fluids are infused to prevent hypotension with regional analgesia and anesthesia. And if a pregnant woman has heart disease, this fluid load could be detrimental. But without the IV fluid, she can have hypotension. And for the interaction with other substances, a woman who ingests drugs, herbal or botanical preparation or other substances may have fewer options because of the interaction between these substances and analgesics or anesthetics. And for example, recent use of alcohol increased the depressant effect of opioid analgesic and making both the mother and the newborn is susceptible to respiratory depression. For the systemic drug, it has several effects on multiple systems because they are distributed throughout the body, and the IV route is generally preferred over IM because the drug effect is a lot more faster and a lot more reliable. And the systemic drug medication should be administered only if the client is willing to receive them and her vital signs are stable. The fetus is at term, exhibits regular movement, has FHR between 110 and 160, with no late or variable deceleration and average variability. And the contractions are well established with the cervix dilated for at least 4 until 5 centimeters in nullipara or 3 to 4 centimeters in multipara. The presenting part is engaged and no complications are identified. These are the drugs that mostly used for systemic drug. They are narcotic analgesics such as meridine, fentanyl citrate, and narcotic antagonist. There are naloxone or Narcan, and the narcotic antagonist is nabufin hydrochloride or Nubane, butalfonal tartrate, Stadol, pentazokin lactate, and each of these drugs has different routes, onset and peak effect, and for how long does the drugs last. And last is analgesic potentiators such as promethazine hydrochloride or Phenargan and hydroxyzine hydrochloride, Zitrac, such as Atrax and Vistaril.
Okay, the next material is about pharmacoregional pain management techniques. The regional pain management methods may be used for intrapartum analgesia, surgical anesthesia, or both. It uses local anesthetic agents on the spinal cord and nerve roots to bring pain relief and numbness through the drug's effect. It has advantages, which are the woman can fully participate in birth, yet the pain is controlled and the sensation of discomfort is reduced. Here's the routes for regional pain. The first one is epidural block, intrathecal opioid analgesic, subarachnoid or spinal block, local infiltration, duodenal block, and paracervical block. The first one is epidural block. It provides analgesia and anesthesia for labor and birth without sedation, and is performed by injecting a local anesthetic agent into the epidural space. Here's the procedures of epidural block. The technique of epidural block is the first is the woman receiving epidural anesthesia must first be put on IV line to give 500 to 2000 milliliter IV fluid to reduce hypertension. And then the anesthetist reviews the medical history, laboratory results, interviews the woman, explains the procedure, and answers the woman's question and obtains informed consent. Next is the nurse can start to give IV bolus and positioning woman for the epidural placement. The next one is the anesthetist prepares a sterile field with the supplies and medication, and the bag is sterilized with alcohol and provide iodine. And then the last one is injected with a local anesthetic to numb the insertion area. A special needle is inserted into the epidural space, and a test dose is administered to test how the woman feels and what she experienced to detect any adverse reaction, and if known, the placement of epidural catheter can proceed. Okay, here's the nursing implication of epidural block. The nurse can stop the continuous infusion after the baby delivery, and the nurse can give a single dose of morphine after cesarean birth, and remove the epidural catheter and applies a sterile pressure dressing to the side. And this is the contraindication of epidural block. The first one is coagulation defects, uncorrected hypovolemia, infection in the area of insertion, or a severe systemic infection, and the last one is allergy. Here's adverse effect of epidural block. There are maternal hypotension, bladder distension, prolonged second stage, catheter migration, cesarean birth, and maternal fever. And here's the adverse effects of epidural opioids. The first is nausea and vomiting, and the last one is pruritus or itching of the face and neck. The next method is intrathecal anesthesia. It also known as spinal block, and it's quite similar with epidural anesthesia. The location is in the subarachnoid space into the spinal fluid, and the woman can feel her contraction but not feel the pain. And this is the advantages and disadvantages. The advantages are rapid onset of pain relief without sedation, no motor block, and no sympathetic block. And for disadvantages are limited duration of action and inadequate pain relief for late labor and the birth. And here's the procedures. The first one is intrathecal opioids can be combined with epidural blocks, or called as combined spinal and epidural analgesia. It provides rapid pain control at the time an epidural catheter is placed within epidural drugs are given. And the procedures is the epidural needle is inserted into the epidural space, and then a thinner spinal needle then injected through the epidural needle to reach subarachnoid space for injection. And the last one is the smaller needle is withdrawn and epidural catheter is placed for injection of epidural medication. And the next method is subarachnoid or spinal block. This method is much simpler than the other methods and can be performed when a quick cesarean birth is necessary and there's no available epidural catheter. And it performed before birth and provides no pain relief during most of the labor. And this method uses 25 to 27 gauge spinal needle to be placed in the subarachnoid space. And here's the contraindication of subarachnoid or spinal block. The first one is the woman's refusal, coagulation defects, uncorrected hypovolemia, infection in the area of insertion, systemic infection, and allergy. The next method is local infiltration. This method is the method of injecting local anesthetics such as lidocaine to non-perineal area before episiotomy. And it doesn't affect pain of uterine contraction and doesn't cause any side effect for mother and for the baby. The next method is pudendal nerve block. It's a procedure which injecting a local anesthetic agent into the pudendal nerves near each ischial spine to relieve pain in lower vagina, vulva, and perineum. And it often used for the second stage of labor, episiotomy, or birth with forceps or vacuum extractor. And the last one is paracervical block. It's the injection of a local anesthetic near the cervix. This procedure provides significant pain relief during the first stage of labor, but once the cervix is completely dilated, this procedure cannot be used. For the advantage is this procedure doesn't block sensation and movement in lower extremities, and the duration of this method is short, so this needs to be repeated frequently. Okay, so next is vaginal birth anesthesia, and there are 6 vaginal birth anesthesia. The first one is local infiltration anesthesia. So this is the aim of relieving pain for a while without the loss of conscious level. So the local agent provides anesthesia in the immediate area of episiotomy or laceration, and a short delay occurs between anesthetic injection and onset of numbness. And then local infiltration rarely has adverse effect on either mother or infant. So the second one is pudendal block. So this is an anesthetized the lower vagina and a part of the perineum. So the pudendal block relieves pain in the lower vagina and perineum for up to 1 hour. As in local infiltration, a brief delay occurs between injection and onset of numbness, and then allergic reaction may also occur. In addition, pudendal block can cause infection in the injection area, and injection of this drug can reduce blood pressure. Third one is general anesthesia. So this is systemic pain control that involves loss of consciousness. So it is rarely used for vaginal births, but it still has a place in cesarean birth. In general, anesthesia may be needed unexpectedly and quickly for emergency use at any stage of pregnancy, such as to repair injuries that result from an accident or domestic violence, or to perform appendectomy. The third one is spinal block. This is a regional anesthetic. So a small needle is inserted directly into the spinal canal in lower back. An amount of medication is then injected into the spinal fluid, takes effect immediately and lasts 1 to 2 hours. With stronger medication can also be used for C-section. Next. Okay, now fifth is epidural block. So this is one type of anesthesia. It's done by injecting local anesthetic into the epidural part of the body. That way, there will be nerve blocks that occur at the spinal nerve roots so as to make the patient unable to survive or able in the body that is judging downward. So the administration is done in the patient's sitting, lateral or prone position with the same target as spinal anesthesia. And anesthetic will make the area around the injection and the body area below the nape will become numb to labor pain. The next is analgesics. So this is a general pain relieving medications, includes opioids such as fentanyl or morphine, usually given through an IV or as an injection into a muscle. So this doesn't block all sensation and feeling and doesn't cause you to lose consciousness. The next is this is the potential risk and side effect for a client. There are numbness may make it more difficult to push and may make it hard to urinate or pee, requiring a catheter to be placed, and then can make the chest numb, which might make breathing seem difficult and causing anxiety. The third one is the blood pressure may drop. If this happens, you will receive IV fluids and medication to help bring your blood pressure up. And then through rare, there is a risk of an allergic reaction, blood clot, blood vessel injury, epidural abscess, swelling, or infection. Next is for the baby. There are two potential risks and side effects. The first one is may make the baby sleepy, which may make it harder to breastfeed immediately after birth. And then a drop in the blood pressure may cause your baby's heart rate and breathing to slow down.
This is the end of our presentation. Thank you for your attention and have a nice day.